Hello, how are you doing?
I'm good.
Okay. My name is Lydia. I'm a student nurse practitioner with UT Tyler. Today I'm going to be doing a physical assessment on you. Is that okay?
That's okay.
Okay. Are you comfortable? Is there anything you want me to get for you?
I'm okay. I'm good.
Okay. All right. Can you please tell me your name and your date of birth again?
I'm JB. Date of birth 3/4/1991.
Okay. What do you do for a living?
I'm a warehouse engineer.
Okay. So what brought you in today?
I have a problem with my left knee.
Oh, so when did it start?
It's been going on like 3 days.
Okay, what happened?
I was playing soccer, so I tripped.
Okay. So any tenderness on the knee right here?
Yeah, it's kind of swollen here.
Okay. Well, I'm gonna do a head to toe assessment real quick on you. Then we're gonna go ahead and look what is going on with the knee. Is that okay?
That's okay.
Okay. First of all, I'm just gonna start with your head. I can see your head is upright and midline. It's not tilted on any side. I can see your hair. The hair distribution is even. The texture is also even and full. There's no hair loss. I'm gonna palpate your hair. Okay. I'm gonna start from the front to the back. I can feel any pain.
Okay.
Okay. No tenderness. No lumps. No bumps. No indentations on there. Okay. I'm gonna palpate your temporal arteries. Can you just take off your glasses for me real quick? Okay. Any pain or tenderness?
No.
Okay. I'm gonna listen for breaths. Using the bell of my stethoscope. I'm gonna listen for breaths. No breaths. Okay. Then go ahead and put on your glasses. Next, I'm gonna inspect your face. I'm looking at your face for lesions. If there were any lesions on his face, I'm gonna check for asymmetry. I'm gonna check for the borders. They shouldn't be irregular. I'm also gonna check for the color. There shouldn't be any color variation. The diameter shouldn't be more than 6 millimeters, and I'm also gonna check for evolving. It shouldn't be evolved. The lesion should be evolving. Okay, so I don't see any lesions on his face. Can you go ahead and puff out your cheeks for me? Okay, make a frown. Okay. The face, I can see there's no asymmetry. There's no weakness on any side. If there were any, I'll be suspecting a stroke. Okay, thank you. Next, I'm gonna inspect his eyes. I can see his eyebrows are symmetrical. There's no coarseness of the eyebrows. The superior eyelids are covering the pupils. I can see on his eye line there are no flakes or any crustiness on there. I can see the eyelashes. He has his eyelashes on either of his eyelids and his outwards. Can you go ahead and take out your glasses for me real quick? Okay, I'm just gonna palpate. Any pain?
No.
Okay, I'm gonna inspect your conjunctiva. Conjunctiva is thick and moist, no exudate. The sclera is white, it's not jaundice. Okay, that is good. Okay, I'm gonna inspect your eyes. Okay, I'm looking for opacities in the eyes, which I don't see any. Inspecting the pupil, I can see the pupil against my pen light. The pupil is round, regular, and equal on both eyes. Okay. Next, I'm gonna do the Snellen. I'm gonna check his visual acuity with the Snellen chart. Clinically, I'll be standing 6 feet away. But for the sake of this video, I'm just gonna stand right here. Okay, go ahead and hold this for me. Go ahead. You can go ahead and put on your glasses. Okay, and I'm gonna hold it. You're gonna read this line for me right here. Okay.
Yeah.
Okay. So go ahead and cover your right eye. Okay.
T H G R S.
Okay. Go ahead and cover the left eye.
T H G B S.
Okay. JB was able to read. He was able to read the letters and clearly, and his vision is 20/20 with corrective lenses. Okay. Next, I'm gonna do cover and cover eye test. So you're gonna go ahead and cover your right eye for me. Same with the paper. With the paper. Okay. Now look directly behind the wall behind me. Okay, take it off and cover the other eye. Okay, that's good. For the cover and uncover test, that's good. For the cover and uncover test, there was no wandering of the eye, so no strabismus. Okay, so I'm still gonna ask you to go ahead and cover your right eye. I'm testing for confrontation. Okay, you tell me how many fingers I'm holding. Okay.
1, 2, 3, 5.
Okay, go ahead and cover the other eye.
1, 2, 1, 5.
Okay, he had full confrontation in all the 4 fields. All right, next I'm going to go ahead and I'll check for 6 cardinal fields of gaze. So you're going to focus on the pen and you're going to follow the pen. Okay. You had any difficulties doing that?
No.
Okay. He did follow. His movements were smooth and coordinated. Okay. Next, I'm gonna check for the corneal light reflex. Okay, you're gonna focus directly on the wall behind me. Okay. I'm pointing the light at the bridge of his nose, and the light reflected symmetrically from both of his eyes, and it was centered. Okay. Next, I'm gonna check for next I will check for pupillary light reflex. Okay. Okay. In clinical setting, normally we have to dim the light of the room, but for the sake of this video, I'm just gonna cover his eyes. You wanna go ahead and take off your glasses real quick? Okay. Okay, there was a direct pupillary response and a consensual response of the opposite eye. Okay, next you're going to focus on this pen. I'm going to check for his accommodation. Okay, now look at the wall behind me, and now the object. Okay, his eyes, his pupils constricted with while looking at the object that was close in front of him. All right. Next, I'm going to perform a fundoscopic exam. All right. I'm going to check your look at your eyes. Okay. Just look at the wall behind me. Okay. I'm going to look at the other eye. Okay. Looking at his eyes with the fundoscope, the fundoscopic exam showed I could identify the red reflex in both eyes. I observed the optic disc. It was clear and had sharp margins. The retina had blood vessels, no exudates, and no hemorrhages. Okay. Next, I'm gonna inspect. Looking at the nose, I don't see any color variation. There are no lesions on the nose. Any pain?
No pain.
Okay. Go ahead and close one nostril for me. Breathe in and out. Or close the other nostrils. Any difficulties breathing? Okay. All his nostrils, breathing was easy. Free flow of air in and out. Okay. I want you now to touch my finger and touch your nose. Quickly. Okay. All right. That is good. Movement finger to nose was coordinated. Okay. Right now I'm going to ask you to close your eyes and I'm going to test your smell. Okay. Okay. Go ahead and close your eyes. Close your right nostrils. And smell.
No.
What do you smell?
Coffee.
Okay. Go ahead and close the other nostrils. What do you smell?
Very nice.
Okay. He was able to identify all the scents, and meaning his olfactory function is good. Alrighty. Next, I'm gonna do an otoscopic exam. Okay. I'm gonna do an otoscopy exam looking at his the nostrils. I'm gonna look for any look at the turbinate. The turbinate should be light red. There should be no foreign bodies in there, no lesions, no polyps, and the septum shouldn't be deviated. Okay. Okay. Looking at his nostrils, there were no polyps in there, no deviation of the septum. The turbinate was light red, and I didn't see any foreign bodies. Okay. Next, I'm gonna go ahead and palpate the sinuses, the frontal sinuses, the maxillary sinuses, and the frontal sinuses. Any pain or tenderness?
No.
Okay, no pain or tenderness. Okay. Next, I'm gonna looking at his ears. I can see his ears well aligned with his eyes. There are no deformities, no lesions on there, no nodules. Any pain? Okay, I'm gonna go ahead and examine examine his ears. Okay. Okay, I'm gonna start with the external structure of his ear. Okay. Looking at his ear, I don't see any excessive hair, no cerumen impact or excessive cerumen. I can observe the tympanic membrane. There's no perforation, no tears. The tympanic membrane, there's movement of the tympanic membrane, and also the cone of light is visible. Okay, I'm going to inspect the other ear. Okay, the other ear, no foreign bodies, no excessive discharges, tympanic membrane, no perforation or tears. The tympanic membrane is it's movable, and the cone of light is visible. Okay, thank you. Okay, next I'm gonna palpate the TMJ. Open your close your mouth. Open, close. Any pain?
No.
Okay. He had no pain at the temporal mandibular joint. I'm gonna go ahead and palpate the lymph nodes, preauricular, posterior auricular, occipital, tonsillar, submandibular, okay, and submental. Any pain?
Okay.
I didn't feel no movable. There were no movable, and he has no pain. Okay. Next, I'm gonna go ahead. Okay. I'm gonna go ahead and the next inspection will be the mouth. Okay. I'm gonna inspect his mouth. Okay, I'm gonna do it through and through in his mouth. Okay, stick out your tongue for me. Looking at his tongue is symmetrical, no tremors on the tongue. Go ahead and touch your tongue to your cheek. Okay, There's equal pressure on both sides. The tongue strength is good. Okay, open your mouth for me. Looking at the oral mucosa is pink and moist, no lesions, no nodules on there. I can observe the dorsal surface of the tongue. There are some fissures on there, no lesions on there. The teeth are yellow, which is normal. The gums, no bleeding in the gums. Where I say ah. Oh. Okay. Observe the bony palate, which is white chest, has some rugae on there. The soft palate is muscular and pink. There's movement of the soft palate, as he said. The uvula is midline, no nodules, no lesions on there. The ventral, the ventral surface of the tongue is has blood vessels, is pink. Okay, thank you. I'm just go ahead, open your mouth. Just go ahead and feel. I don't feel no nodules in the mouth. Anything? Okay. So next, I'm gonna go ahead and do the observe. Look at his neck. Looking at his neck is it's midline, it's symmetrical, no lesions on there, no abnormalities, no excessive skin fold, no webbing. Okay, I'm gonna access to see the trachea. Trachea is midline. Okay. Now I'm gonna palpate the lymph nodes of the neck. I'm gonna do the posterior cervical, anterior cervical, superficial cervical, and the deep cervical, and the super clavicular lymph nodes. Okay. Now I'm gonna do range of motions of the neck. So go ahead and look left, look right. Extend your neck up, chin to chest. Okay. Try to come against my hand, against this one. Okay, shrug your shoulders, try to, okay, which is good. Any pain? Okay. Range of motion was performed, was smooth and coordinated, and no pain. Okay, now I'm gonna palpate the trachea. All right. Okay, I'm gonna start from the front. Any pain? I don't feel no nodules on there. Okay, so turn and face the camera for me. Sit and face the camera. Okay. So you're gonna hold this when I ask you to drink water. You're gonna swallow for me. Okay. I'm gonna palpate from the back. Okay. So go ahead and swallow. Drink some water. Okay. There's movement of the thyroid gland with swallowing. Any pain? Okay, no nodules or masses on the third. Thank you. Okay, go ahead and sit well. Okay. Next, I'm gonna do a chest exam. I'm looking at the anterior chest. Breathe is comfortably seated. Breathing is symmetrical. We're just gonna breathe normally for me. Okay. All right. Okay. In a clinical setting, I'll count his respirations for a full minute. For the sake of this video, I'm not going to count for a full minute. Okay. Respirations were 16 breaths per minute, and it was regular. Okay. Looking at the anterior chest, I can see it's not funnel. There's no barrel of the chest. There's no use of accessory muscles of the chest. There are no lesions on the skin or any deformities. Okay. Next, I'm going to ask you to turn and face the camera this way. Okay. So right now, okay. So can I face this way from me? Okay. So right now I'm looking at the back of his chest. And I'm gonna perform. I'm looking at it. I don't see any abnormalities. I don't see any lesions on there. I'm gonna palpate for tactile parameters. Whenever you see me touch your chest, you say, go ahead and say 99, okay? Go ahead and move a little bit forward. Okay. Okay. Go ahead.
99, 99, 99, 99, 99.
Okay, vibrations were equal on either side of the chest. Okay, I'm gonna go ahead and place for expansion. Okay, go ahead, breathe in and out. My fingers are at T, between T10 and T9. Go ahead. Again. Okay, there was expansion on either side, it was equal. Okay, now I'm gonna go ahead and I'll test for lung excursion. Okay, I'm gonna palpate from area of high resonance to dullness. I'm gonna pay cost. Oh, go ahead and take in a deep breath and hold. Okay, breathe normally. Go ahead and mark it right here. I'm gonna palpate to the new area of dullness. Go ahead and take in a deep breath and exhale and hold. Exhale and hold. Okay, mark it here. I'm gonna do the same thing on the other side. Go ahead and exhale and hold. Inhale, exhale and hold. I'm gonna mark it. Okay, go ahead and breathe in and hold. Okay, breathe out. Okay, now I'm gonna measure. Okay, diaphragmatic excretion is 5 centimeters and it's equal on both sides. Okay, now I'm gonna listen. Okay, you're gonna breathe in and out. Okay, whenever you feel the stethoscope on you. Okay, go ahead. Okay, lungs were clear to auscultations and no consolidation heard. I didn't hear any adventitious sound, no rhonchi, no bronchi, no stridors. You're gonna go ahead and say air for me, okay? Say air each time you feel the stethoscope on you, okay? Okay. The air sound was heard throughout with the lungs, and at no point it changed to the A sound, which means there is an abnormality. Okay. So you're gonna turn to the front. Okay. I'm also gonna palpate for tactile parameters. So whenever I feel my hand on your chest, you're gonna go ahead and say 99. Okay.
99, 99, 99, 99.
Okay. Also, I'm gonna go ahead and say cough. Okay. Resonance was heard over the lungs, and those dullness over the diaphragm. Okay, I'm gonna go ahead now and listen. Breathing out. Okay, lungs were clear to auscultation bilaterally, no consolidation, no there was no adventitious breath sounds, no rhonchi, stridor, or wheezing, or crackles. Okay, I'm gonna go ahead and say air for me. Okay. Air sound was heard throughout the lungs, and at no point did I hear the A sound. Okay. Now I'm gonna go ahead and ask you to just turn around for me. I'm gonna taste for costal vertebral tenderness. Okay. Tell me if you feel any pain. Okay.
No pain. No pain.
Okay. All right. So next I'm gonna in a clinical setting, he was supposed to be laying down 30 degrees, but for the sake of this video, I'm gonna use this pillow, and he's gonna lay down on it. Okay. Go ahead and lay down. Okay. Turn your head to the left side. Okay. Using the pen light, I'm gonna observe for the pressure, the JVD, and looking at the vein, the jugular vein pressure. There's no jugular vein distension on here, and the carotid is there's pulsation, no abnormal pulsation of the carotid, and the venous jugular vein pressure is it slows down with inspiration. Okay, I'm gonna check the other side. Okay, there is no abnormal pulsation. Next, I'm gonna okay, next I'm gonna palpate the carotid pores. I'm gonna do that one at a time. Okay. Okay, and I'm gonna auscultate for bridge using the bell. Okay, no bridge. Okay, next I'm gonna observe the pulse of maximal impulse. Normally in normal individuals we cannot see it, but it's usually at the mid-clavicular fifth intercostal space. Okay, I'm just gonna pop it and feel. No abnormal pulsations. I'm gonna palpate the chest, feeling for lift. And tenderness, hips and tenderness. So any tenderness?
No.
Okay, I don't feel any lift, hips on the chest, and no tenderness. Okay. Next, I'm gonna palpate the pericardium. I'm gonna palpate the pericardium at the apex, at the left sternal border, and at the base. Okay. Next, I'm gonna palpate the aortic, pulmonic, Epps point, tricuspid, and the mitral valves. Okay, I'm gonna auscultate, using the bell of my stethoscope. I'm gonna palpate the aortic at the right intercostal, second intercostal space, right sternal border. The pulmonic at the left intercostal space, left sternal border. The herbs and tricuspid will be from second, third to fourth intercostal spaces, left sternal border, and the mitral will be on the mid-clavicular line, fifth intercostal space. And here I'm going to count the pulse for 1 full minute. Clinical setting, I'll count for a full minute, but for the sake of this video, I'm gonna count for 30 full seconds. heart rate was regular and 82 beats per minute. Okay. Now that we're here, I'm just gonna go ahead and do an abdominal examination. All right. So I'm gonna inspect the abdomen. Is it okay if I lift up your shirt to check the abdomen? Okay. Okay. Looking at the abdomen, I'm observing the abdomen. I'm looking for striae. There are no striae. I don't see any lesions, no masses on there. The umbilicus is inverted and it's midline. Breathing is symmetrical. No difficulties in breathing. Go ahead and lift your head and look at your okay. I don't see any protrusions. That's okay. I'm no pain. Do you feel any pain?
Yeah.
Okay, no pain or tenderness. Didn't feel any pain or tenderness while he was lifting up his head. Okay, next I'm gonna go ahead now. I'm gonna go ahead and palpate. No, I'm gonna go ahead and auscultate. Okay, I'm using the bell of my diaphragm. I'm gonna auscultate the right lower quadrant, the right upper quadrant, the left upper quadrant, and the left lower quadrant. And bowel sounds, the active bowel sounds. Now I'm gonna go ahead and auscultate the arteries of the abdomen using the bell of the diaphragm. Aortic, right renal, left renal, left iliac, and right iliac. I'm also gonna go ahead and just auscultate the femoral artery right here, right here. Okay, and I'm also going to auscultate for tympani and dullness. No, I'm also just gonna auscultate. I'm gonna pick out for tympani and dullness. Okay, I'm gonna pick out the 4 quadrants of the abdomen. Okay, there was generalized tympani and some scattered dullness throughout the 4 quadrants of the abdomen. Okay, now I'm gonna identify the borders of the liver. I'm gonna start from the right upper mid clavicular line on the upper chest right here. Take us going downwards to where there is dullness. Okay, and I'm gonna mark it right here, and I'm gonna start from the lower pecos to where I get dullness. Okay, I'm gonna mark it. Okay, I'm gonna measure it, and it measures 7 centimeters, which is normal. Okay, and I'm also gonna put because the spleen right here from the mid axillary to where there is dullness. The spleen, identify the spleen right here. I'm gonna do superficial palpation. Okay, with one hand. Tell me if you have any pain or tenderness. Okay.
Okay.
Any pain?
No pain.
Okay, I'm gonna go ahead and do deep palpation right now. Any pain?
No pain.
Okay. Okay, I'm gonna go ahead and palpate the liver. Taking a deep breath. Any tenderness?
No.
No tenderness in the liver. Okay, I'm gonna go ahead and palpate the spleen. Taking a deep breath. Any tenderness?
No.
Okay. No, I didn't palpate the liver or the spleen, which is mean there's no enlargement of the liver or the spleen. I'm gonna go ahead now and palpate the lymph nodes, the inguinal lymph nodes here on both sides. Any pain?
No pain.
Okay. I'll palpate the epicondral lymph nodes right here. Any pain?
No pain.
The axillary lymph nodes. The pain?
No pain.
Okay, just this right here. Any pain?
No pain.
Oh, right here, the epicondyle, right here.
No pain.
Okay, and right here.
No pain.
Okay, and I'm gonna palpate the pulses. I'm gonna do the dorsal looking. I'm gonna examine the lower extremity. Looking at it, looking at its feet. I don't see any lesions on there. No deformities. Hair is evenly distributed. I'm gonna feel for the temperature. Also gonna look at the upper extremity. I don't see any deformities on there. Hair is evenly distributed. Also feeling for the temperature on both sides. Okay, no lesions. I'm gonna palpate the pedal dorsalis pulse. Normally in the clinical setting, I will palpate for a full minute. I can feel the pulse right here. Okay, palpate it right here. Okay, and the posterior pedalis, posterior right here. Palpation right here. I'm gonna palpate the popliteal pulse right here. Okay, the pulse is good. Okay, it's regular and symmetrical on both sides. Palpate the radial pulses. Okay, palpation, normally I'll still reiterate, we'll count the pulses for a full minute. Symmetrical and regular on both sides. The brachial pulse. Symmetrical on both sides. Okay, next I'm gonna go ahead and look test for capillary refill. Less than 3 seconds. Less than 3 seconds. Can you see it? Yes. Capillary refill of the upper extremities. Okay, less than three seconds. Okay. Next, I'm going to ask you to sit up for me. Okay. Now go ahead and put your fingers like this. I'm checking for clubbing. The nail base angle. There is no variation. There's no clubbing on there. Okay, next I'm gonna do a range of motion. Okay, I'm gonna just feel any pain.
No.
Okay, now I'll ask you to extend your arms for me. Okay, right up. Okay, cross both arms. Okay, extend it. Flex it. Okay, extend. Hold your arms. Okay, extend. Okay, open, close. Okay, down, upward. Okay. All right. Put your arms this way. I'll try to push down against me. Okay, close your arms. Try to against. Try checking for strength. Okay. Push, pull. Okay. Hold my finger. Push. Okay. I'm gonna check for your fingers. Let's see. Any pain?
No.
Okay. Okay, just do like this for me. Okay. While we're there, close your eyes for me. I'm gonna put an object in your hand. You tell me what the object is. Okay.
It's a key.
Okay. Checking for stereognosis, and he was able to identify that it's a key. Okay. Okay. I'm gonna check for range of motion of your. Can you sit a little bit back? Push back. Okay. I'm gonna check for range of motion of your legs. Okay. Okay. Go ahead. Try to. Since you said the left knee was hurting, I'm gonna do the left knee last. I'm gonna do range of motion. Okay, take it up. Bend forward, bend your knees. Okay, out this way, in this way. Okay, I'm gonna do the draw test. Okay. Try to pull your knees. Anterior draw test. Any pain? Okay. I'm gonna do the McMurray's. Do an in with your foot. Outwards. This way. Anything? Okay, I'm gonna do the leg massage to check for your ligaments. Okay. And then let's keep ligament. Okay. Alrighty. Next I'm gonna check this foot. You know it when it hurts, okay?
Yeah, it hurts.
It hurts, okay. I wasn't able to perform range of motion on his left foot since he said the left foot was hurting. Okay. Next I'm gonna check for strength. Okay. Try to. All right. Push. Okay. Push. Push. Okay. Hold on. Okay. Push. Push. All right. Okay. Okay. Next, stand up for me. I want you to okay, I want you to take a walk from there to the camera and back. Okay, your movement is smooth. Walk on your tippy toes. Okay, walk on your heels now. Okay, walk going back, walk heel to toe like this. Going back heel to toe. No, going, turn around and walk heel to toe. Yeah. Okay. Next, I'm going to ask you to close your eyes. Okay. Now I'm doing the Rombeck test. There's no excessive swaying. Okay. Go ahead and open your eyes. Go ahead and just stoop for me like this. Okay. That's good. Now I'm going to go ahead and check the spine. Come around this way. And okay, touch your toes. Okay, checking for unevenness. I can see the spine is symmetrical. I'm gonna check for the spinal process. It's even. Any pain?
Okay.
Okay. Alrighty. Sit up. Stand up for me. Twist to the left. Twist to the right. Okay. Lean towards the right. Lean to the left. Okay, go ahead and sit down. Okay, thank you so much, Mr. JB. Do you have any questions for me?
No questions for now?
Okay, so we're gonna go ahead and do more tests on your left foot, and we'll see how we can help you with the pain. Okay.
Okay.
Thank you so much for your time. I appreciate it.
Thank you.
Okay.